Well, welcome to today's Global Update. It is Wednesday, the 8th of April. Easter's coming up, and for most of us, we'll be spending that time indoors or in the immediate proximity of our houses, I'm afraid, but I trust we'll all have a good time. Plenty of online churches and things you can tune into in your area if you want, just that you can't go out to one. Now, let's think about a bit of a global update, what's going on in the world. So these are the official number of confirmed cases, and these are the number of deaths. We know that both numbers are actually way higher in reality. Now, just a quick mention of Africa before we go on to other news. Over 10,000 cases now confirmed in Africa. Ethiopia is the latest country to declare a state of emergency. And I remain very anxious about Africa. I think the disease is going to spread there rapidly, and I think the death rate could be relatively high, unfortunately. Partly because there's a lot of comorbidities, there's a lot of pre-existing human immunodeficiency virus syndrome, the AIDS type syndromes, although many are being moderated with antiretroviral drugs, but it's still not known how badly these people will be affected. And an awful lot of undiagnosed and untreated pathology in Africa, as well as all the tropical conditions and malaria. We've got hypertension, obesity, heart disease, a lot of diabetes. So plenty of reasons to be anxious about Africa, I'm afraid. Now, coming on to details today about the United States first of all. Now, the United States basically is the main growth area for the COVID-19 pandemic at the moment. About 400,000 cases are now confirmed, and this is only going to keep going up for the next days anyway, probably a week or two. Deaths, I believe that's the highest daily death rate so far in the United States. 1,800 individuals. That's a lot of people sadly lost in the United States in 24 hours. New York and New Jersey severely affected, but the rate of hospital admissions in these areas are slowing down. Now, this is good because it means that the shutdown measures in New York and New Jersey are starting to filter through. That's good because remember, first of all, we see reduction in the number of new cases, then the reduction in hospital admissions, and then the reduction in deaths. But because we can't really see the number of new cases because we don't have adequate testing, the first indication that we get that there actually is a reduction in the number of new cases is a reduction in the number of hospital admissions, then followed by a reduction in the number of deaths. But we have this painful lag between them. Now, a bit of a spat going on here. The president has said World Health Organization funded may be restricted. The President, Trump, said they called it wrong. They should have known. And to be fair, he's got a point. They did call it wrong. Many people, including this channel, in February, late January, were worried about a pandemic. The World Health Organization said carry on flying in and out of China, there's no problem. Well, they didn't say there's no problem, but they said they didn't want to disrupt things. They got it wrong. And these are the people that we pay to be the experts. So when the president says they should have known, I must say I tend to agree with them. These are the experts that are getting paid to monitor this very thing, and they got it wrong. They should have known. And the president also said they're China-centric, which, again, I can understand why he's saying that. World Health Organization hit back saying it's not time to cut funding. There you go. Now, this is alarming. And I only heard this for the first time this morning, actually, and I've been doing a bit of work on it since. But the Surgeon General of the United States, African Americans are more affected than white Americans. Now, what are we saying here? Are we saying that African Americans are getting more infection than white Americans? Well, I don't think we're saying that. I think the infection rates are probably the same in both. But African Americans seem to be getting more complications, more severe disease, and more deaths. Now, a bit of support for this. Data here is from Michigan, Chicago, New Orleans, East Boston area, where the deaths have been reported in terms of the background, the racial, ethnic background of the individuals. Now, for example, Chicago, 68% of deaths were in African Americans. And that compares to the African American population only representing 30% of Chicago's population. So 30% of the total population of Chicago is African American, 68% of deaths. And there's a figure there as of Monday the 6th of April. 1,969 black Chicagoans died. That's a lot of people. 891 white Chicagoans. I'm probably pronouncing that wrong. Apologies if you come from Chicago. Latinos and Asians as well. Now, the question is, of course, why? Why is this? Well, the comment I've seen so far has been quite sociological, socio-economic reasons. And we know there are health inequalities. We know there's a high prevalence of chronic illness. So heart disease, diabetes, obesity, hypertension are all more common in the African American population. And there are inequalities in access to health. So there's a lot of potential socio-economic explanations for this. Another one is that African Americans often use more public transport. They often work in the care sector. So these are quite possible. But what no one has mentioned so far, and I don't know how much this is a factor, but no one has mentioned the vitamin D. So I'm mentioning it now. And I think this needs widely publicised. Let me give you a simple scientific fact. White skin makes vitamin D more quickly in sunshine than dark skin. Most vitamin D comes from sunlight exposure on the skin. Not so much vitamin D comes from our diet. It's a fat-soluble vitamin. Are we back? Yeah. It's a fat-soluble vitamin. So the darker someone's skin is, the slower they're going to make vitamin D. So I think that is probably a big factor in this. I don't know what we would need to do. Well, what authorities in the United States would need to do is they would need to do extensive testing of the blood levels of vitamin D in African Americans and compare that to the levels of vitamin D in white Americans and compare that with the morbidity and mortality that we are seeing. That's what would need to be done. But especially when you're thinking about somewhere like Chicago, I mean, it's the end of the winter. It's been a long, dark winter up in Chicago. People haven't been exposed to the sun, and people with black skin, when they are exposed to the sun, make vitamin D more slowly than people with white skin. And to me, this is important because we know, we've looked in previous videos, there's vitamin D receptors in the immune system. We know this. We know that lack of vitamin D causes immunodeficiency. It's been empirically demonstrated with studies on influenza. But the theory and the rationale for vitamin D having a big effect on immunity is there. And another point is, in terms of evolution and adaptation, the original humans who came from Africa, or Adam and Eve, whichever way you want to look at it, they would be black. They were black. The only advantage of being white that I am aware of is that you make vitamin D more quickly. So the reason I'm white has got one simple biological reason, so I can make vitamin D more quickly. That points to me that vitamin D is indeed important. So if my ancestors went to all the trouble of changing their skin colour so they could make more vitamin D, I think there's a good reason for that. So I really think that people with darker coloured skin all around the world should be considering their vitamin D status. And if it was just a matter of bunking up the vitamin D in African Americans, my prediction is, my hypothesis, my working hypothesis would be that that would reduce the amounts of complications and deaths. So do consider vitamin D, do make further studies on that, do talk to your doctors, do get people looking at that, because I think it's a big factor. Now, the United Kingdom. My Prime Minister is the only world leader in intensive care at the moment, and we wish him well. Now, he's on what he calls standard oxygen treatment. Now, I think what this means is that there's kind of 4 levels of treatment that we can give in terms of respiratory therapy. There's giving extra oxygen. So this is oxygen gas. Now, you can give you can give 24% through nasal cannulas, or you can give 50% or more through oxygen masks that fit over the face. So that's just giving supplementary oxygen. And it sounds like that's where Boris is at the moment. But the second level of respiratory support is CPAP. CPAP stands for continuous positive airway pressure. Now, this can be done via pressurised hoods or pressurised tight-fitting masks. Now, we used to use hoods where I live now, but they come from Italy, so we ran out of them. But we can use the tight-fitting masks, and these blow air in. So that's just oxygen. That's oxygen plus pressure. Then the third is full ventilation. And in ventilation, you have to put a tube into the trachea and blow into the trachea, or you have to make a tracheostomy hole and blow in through that, again with positive pressure. So that's much more invasive. CPAP's great. If we give a lot of people CPAP, that can stop a lot deteriorating to the point where they need ventilation. Because we've been looking at studies yesterday, for example, where ventilation is associated with a very poor prognosis, unfortunately. So we need to keep as many people off ventilation as we possibly can. And the statistics yesterday from the intensive care audit did tend to back that up. And the fourth level of respiratory intervention, which I've never seen, is ECMO. That stands for extracorporeal membrane oxygenation. In other words, this is a lung machine that's outside the body. We've sent patients up for this. We've got a specialist centre in Edinburgh, I think it is, where I am, but I've never actually seen it. But the blood is taken out of the body, oxygenated, then put back in the body, which is clearly a much more invasive procedure. So there, and we haven't got a limited facility for that anyway. So they're the 4 levels: oxygen, CPAP, ventilation, ECMO. And it looks like the Prime Minister's at the oxygen level, as indeed many people will need to be. We really need to think about our oxygen supplies. So Prime Minister stable. Increased number of deaths, increased number of cases in the UK, an increased number of deaths in the UK. I think that's the highest number of deaths. But the number of cases is actually levelling off a bit. We are starting to see a slight levelling off in the number of new cases as we are well into the second. In fact, we've had 2 weeks. We're into starting the 3rd week of lockdown now. But because of this lag effect, deaths are still going up. And unfortunately, the deaths will keep going up for the next few days, unfortunately. So the death rate doubled in the last 4 days, and then doubled in the last 4 days, but doubled in the 3 days before that. So the rate of increase it's still increasing, but the rate of increase is decreasing. But what we're seeing is the rate of deaths still increasing. And that will be so for a period of time, unfortunately. So the curve isn't quite as steep. Now, the death figures now, total number of deaths are 6,159. By the weekend, that's probably going to be about 10,000. So this is going to increase. Now, this is hospital deaths. The real number of deaths is officially estimated to be 20 or 30% higher than this. And in my estimation, it's way higher than this, because there's an increased number of funerals where I live this week. And I'm sure that's the same everywhere. And there's a big lag effect between death and funerals. So this indicates to me there was an increase in deaths in my area a week or 2 ago, which indicates there was people becoming symptomatic 2 or 3 weeks before that because of this lag effect, which indicates there was more community transmission than we had thought. So I suspect the real number of deaths is actually significantly higher than this, because people are dying at home undiagnosed officially with COVID-19. Peak deaths should be within a week, and they're probably going to be at the rate of 700 to 900 deaths per day, is what modellers are now looking at in the UK. Now, this was interesting. Porton Down is the big hush-hush biological who knows place in my country. I think they do like antidotes for biological weapons and things like that there. And anyway, it's the state of the art in my country. So what they've done is they've taken blood samples from 800 people as a randomised sample from round about the country. And they're testing them for the presence of the antibodies. Remember, the antibodies to see where the virus has been. So they're testing for the antibodies. And because they've taken a random sample, they should be able to extrapolate from that from the whole population. So it means pretty soon, within a few days, we should have an estimate of the total number of people in my country that have been infected. It could well be 5 or 10%. It could even be higher. But because this is a random sample, you get these polls before elections where they take about 1,000 random people from around the country. From that, they can work out reasonably accurately what the election result is going to be. So this is the same. Because it's a randomised sample selected from around the country at random, just 800 people taking the blood, seeing how many of them have the antibodies. This should tell us how many people have been infected. And this in turn will allow us to estimate the death rate very accurately, or much more accurately than we have been. And it will also allow us to estimate the degree of herd immunity that we have already developed in the country. So very important data there coming out in the next few days, hopefully, courtesy of Porton Down antibody analysis on 800 random blood samples. Now, Spain, confirmed cases. Deaths have actually increased a bit in Spain, but it's probably an effect from the weekend. Now, the number of deaths is appalling, and I'm sure in Spain there's many people dying at home who aren't officially recorded as well. But basically, Spain and Italy are now seeing a decrease in the daily death rates. So this is a blip from the weekend, but my prediction here would be in Spain and Italy that this number would be hopefully well down. And by next weekend, I would hope this is down towards the sort of 500 a day mark. Now, that's still a lot of deaths, but unfortunately we can't expect the deaths to stop all of a sudden, that they will tail off gradually. It's appalling talking about so many people's lives in this way, but to get an overview of the pandemic, I'm afraid this is what we have to do. So I'm hoping by next week that in Spain and Italy, in Spain for example, the number of deaths will be down by a few hundred per day, and then the week after that they'll be down by another few hundred per day, until in a few weeks' time hopefully they'll be down to pretty well zero. So although that's up, the trend is good as the effect of the lockdown works through into fewer cases, fewer hospitalised patients, fewer deaths. Now, Italy, I'm not going to go through the figures in Italy again, we've done those many times, but this was fascinating. In a strange kind of way, fascinating. What the Italian authorities have done is there's a village near Rome, 1,900 people in it, and they've just closed it off. You can't go in, you can't go out. The village is completely closed off because there's been a lot of COVID-19 cases there. So from a purely pandemic management point of view, this does make sense. So what they think was there was quite a few cases in a care home for older people and disabled people and things that spread out into the community, into the wider community. So now in this village, there's quite a lot of people are infected, they believe. So what the authorities are doing in Italy is they're testing every single one of them. All 1,900 people are being tested. And they're doing a lot of analysis at how the virus has spread. Because this village is like a small sort of microcosm of the totality of the epidemic in Italy and the pandemic around the world. So they're looking at how the virus has spread in detail within this village. And because they're testing everyone, they'll know the total number of people infected, the total number of people not infected. They'll collect data on the total number of people with symptoms. Therefore, they'll be able to work out how many people were symptomatic. Because it may be that 50% of people who get the COVID-19 virus, 50% don't get any symptoms at all. That's what Dr. Fauci was saying yesterday in the States. So this will show us that. So this is kind of a case study. Now, it does sound a bit draconian, closing a village down, but I actually believe it is in the villagers and the people's roundabout best interest to contain the outbreak in this village. So it does seem to need to be done. But the Italian authorities are taking full advantage of this to collect this sort of essential data. So within a few weeks, we should know what proportion of people catch the virus in a particular population. I would expect probably 60 or 70% of people in the village have the virus. Interesting to see how many develop no symptoms, how many develop symptoms, how severe those symptoms are. So some really quite fascinating data coming out from the UK and Italy soon, which we look forward to. And of course, it can't come soon enough, because it's not that it's interesting, it's the fact that we can use this data to save people's lives. That's why it's interesting. China, 62 new cases, mostly from backflow. That's people from China going back home. Wuhan, travel restrictions partly lifted after 11 weeks of lockdown. But the reason I mention this, and this is interesting, so can't find my phone, but everyone on their phone has got a code in Wuhan. Interesting. So everyone's got a code on their phone. So you have to enter this app and put all your information into this app, your national insurance number and everything like that. And then it maps where you've been, and it correlates that with areas where the virus has been, where there's been infection. And if you've been in areas where you're likely to get infected, it will give you an amber warning. And if you're very likely to be infected, it will give you a red one. And it's collating all this personalised, individualised data on the phone. And without a green card on your phone, you can't leave the city. Now, this means the Chinese are able to track accurately who is at very low risk of transmitting the virus, who is at moderate risk of transmitting the virus, and who is at high risk of transmitting the virus, and being able to regulate their movements accordingly. But it's all done through this vast data network where people have all this information on their phone. So their phones are constantly reporting back to these central computers, and the central computer is giving them a code, allowing them to move around. And this strategy does seem to be working. Now, if I say it's a good idea or a bad idea, I'll get blown to pieces. I know that, so I'm not gonna make too much of a comment on it. But it's one to be thinking about. This is going to be a challenge that everyone's going to have to face. There are going to have to be differentiations between individuals if we are to lift these lockdowns that we are currently in, and we can't stay in the situation we're in for too much time. Now, Hubei, I mean, it's not saying there's no restrictions. There are still restrictions. So Hubei, where Wuhan is located, limited going in and out, still must wear a mask, only going out for essential purposes. And there's quite a lot of patients still hospitalised in Wuhan as well. So it's not the end. Let's just hope it's the beginning of the end. End of the beginning, something like that. Actually, to say it's the end of the beginning does raise the possibility of a second wave, which is certainly, obviously, a major ongoing risk. Saudi Arabia, cases, deaths. Things are getting worse in Saudi Arabia. Officials are saying they're expecting between 10,000 and 200,000 infections. That's what they're expecting. They're hoping to be able to keep it down. They're taking huge measures in Saudi Arabia. And their record so far has been good. Saudi Arabia has been reasonably proactive, and yet are still expecting this number of infections. Let's hope it's towards the lower end, or is at the lower end. They've got drones flying over public areas taking body temperatures. Again, quite a surveillance measure, but it does seem to be working. So if you've got a temperature, so if you're going in a shop in Saudi Arabia, you've got a temperature, the drone will see you and say, "Oh, you can't go in that shop." Mecca and Medina still closed off, of course, to Islamic pilgrims from around the world, which is a huge thing for them. France, things still bad in France, actually. In Paris, I'm not sure about the rest of France, but Paris, people are no longer allowed to exercise outside. So the lockdown actually more stringent. And the Charles de Gaulle aircraft carrier, rather like the Roosevelt one was it? I've forgotten. Anyway, the Roosevelt aircraft carrier in I've forgotten in the United States. So again, but the point is, people living together in confined spaces, in ships, in this case, is a problem. Now, Belarus don't seem to be taking this seriously at all. So cases are increasing. There was a football match in Minsk. The teams were shaking hands. Apparently, the president has said that people should be taking saunas or drinking vodka to help the virus. And I saw people kissing crosses as a religious dedication in public. Then other people kissing them. I don't think you need me to comment on that. I'm not going to comment further because I get criticised too much when I bring up religious topics. But sharing of saliva, this is not the time for sharing saliva. Now, just to go back to the president's comments, saunas might actually be quite useful, although not a panacea by any means, but raising and cooling the body temperatures might have some efficacy. Having said that, I don't fancy it myself. Vodka. So vodka is an alcoholic drink. It's normally about 40% alcohol. And let me be quite clear. If you use 60% alcohol hand gel, that's going to kill viruses on your hand. You drinking any amount of vodka will not prevent you getting the virus. In fact, drinking alcohol may predispose you to getting the virus. There's evidence that that might be the case now. So people should be drinking less, not drinking more. So can I reject the president's advice and advise you not to drink extra vodka or any other alcohol for that matter as a prophylaxis to prevent the infection? Now, Denmark, not quite sure what's going on there. They're talking about a controlled reopening, which is interesting. If that's done in a highly controlled way, it'd be interesting to see how it works. As in China, they're going to have some way to monitor who's at risk and who's not. Don't know how they're going to do that. But the borders are still closed to the 10th of May and no large events till the end of August. So it's not as if things are back to normal there, but interesting to see what they're doing. India, the lockdown is causing massive problems and actually causing hunger. Thousands, if not millions of people have been walking home to their villages, and the lockdown looks like it's going to be extended. And I'm still very, very worried about India. I think eventually the virus will start spreading in India. I don't like giving pessimistic predictions, but from what I know about this virus and from what I know about India, I think the virus will be a major, major outbreak in India, and I will continue all Indians and Indian authorities to do whatever they can to slow this down till we know more. Slow it down to nearer and nearer the time when we'll have a vaccine, to when we'll have massive, cheap testing. South Korea are exporting huge amounts of test kits, so South Korea got their act together on testing. Other countries that could be mentioned, such as the United Kingdom and the United States, were late to the party. And in fact, my country still hasn't arrived at the antibody testing party yet. We still don't have extensive antibody testing. That's why I've had to send these 800 samples to Porton Down. Canada, it's increasing. But the Canadian restrictions are working to a large extent, is the impression I'm getting. Now, Australia's a bit of a success story. Not too many cases, and the number of new cases is going down. 39 deaths, which is bad, but not as bad as other places. Nowhere near as bad. Well under 300,000. We've done well over 300,000 antigen tests, 1.9% of who were positive. But of course, when you know who's positive, you make your enemy visible. And you can then start working on precise targeted strategies to defeat your enemy, which is the COVID-19 virus. The majority, now there is community transmission in Australia, but the majority of cases, something like 60%, have been acquired from overseas. And the hospitalised numbers aren't too bad. New South Wales 240, Victoria 35, Queensland 43, Western Australia 58, Northern Territories 24. So manageable at the moment in Australia. Let's hope it stays that way. And I thought this graph was interesting here. So we've got deaths by age group and sex. So, okay, we're only dealing about 39 deaths, but great to see there's no deaths in the younger age group. That's always nice to see. And so this is males here and females here. So that's males. So it's not enough to be statistically significant. Well, it is enough to be statistically significant, actually. We're seeing more deaths. I know that's a bit of a difference there. There's more females there than males there, but that probably is just a bit of a blip. But overall, we're seeing more males dying than females. Now, in the over 90s, it's reversed, but that's because a lot of the men have already died by the time they're over 90. So it's not a fair sample. So as in my country, the severe complications in men are about 3 times more common than in women. Good time to be a young woman. They get the least. Having said that, there are tragedies, but they are much less common. Now, I've got some other things to tell you today, but I've gone on a bit already, so I think we'll leave it there at those pointers to be going on with. Let's just make a bit of a conclusion. So Italy, Spain, the United Kingdom, we're seeing some encouraging signs, but the lockdown's going to have to carry on till we get massive testing. It's massive testing. That's our exit strategy from this lockdown, because the vaccine's not here yet. I'm worried about Africa. I'm worried about India. I'm worried about Asia. I'm worried about Southeast Asia. Australia are doing well, better than we're doing in Europe, but signs of hope in Europe. America, the United States, things are still getting worse. And I'm worried about Mexico. And I'm worried about South America. Globally, the number of cases is going to carry on rising. Globally, the number of deaths is going to carry on rising. We just have to try and reduce this in any areas where we can have any influence. And for many of us, that is staying at home over the Easter bank holiday.